So the next one will be how to distinguish upper respiratory infection to viral syndrome. Again, consult with your provider. What I'm going to present is basic implementation of upper respiratory infection and viral syndrome and what to tell your parents. So welcome back to the Wandering Nurse Practitioner channel. The upper respiratory infection for neonate. If there's a low concern for RSV due to presentation, continue to make sure to provide high quality breastfeeding, of course, which is like the best source of oral hydration to prevent them from dehydration. Make sure they have at least more than 6 diaper changes within the last 24 hours. Also evaluate their respiratory effort. You advise them with using nasal sprays or nasal drops and bulb suction to clear their nasal passages because they cannot blow their nose. Elevate the head of the bed and use like a cool mist vaporizer. Parents aware that we should tell them to seek immediate care if there's always a question about them with a hard time breathing. They have wheezing, not resolved with nasal aspirations and humidification. Breathing faster than like 40 to 50 breaths per minute, having nasal flaring, retractions, or they're acting very sick and conditions does not improve with home care. For kids with upper respiratory infections less than 2 months of age, so close to that, explain to them that children with immature immune systems and respiratory systems can be affected by minor viral illnesses. So mother needs to work at monitoring their respiratory effort. Make sure that they clear their nasal passages by using nasal drops and bulb suction, or some of the parents do use nose Frida. Parents should be advised on seeking immediate care right away if there's a question about their breathing, dehydration, retractions, and if home remedies are not helping them and it's not improving at home. For upper respiratory infections more than 2 months of age, of course, review with children that the immature immune systems and otherwise healthy can go from one illness to another. So again, emphasize the need for fluids, rest, antipyretics, or as needed, antipyretics as needed. And mother is experienced with illness and ask appropriate questions. Make sure that you provide them anticipatory guidance about the current plan, and emphasize also to seek immediate care right away if a child has a hard time breathing, wheezing, and home remedies are not working. Also, make sure that you provide a school note for their absence and expect illness to be 7 to 21 days. So just ask the parents what they need. So for viral illnesses, explain to parents that viral illness can last for like 7 to 21 days. Provide rest, fluids, ibuprofen or acetaminophen for fever or discomfort. Also evaluate their respiratory effort. Use the saline drops or spray and bulb suction. Elevate the head of the bed. Cool mist vaporizer is very helpful for kids more than a year of age. Honey for cough and sore throat as needed. There are instances that are kids that are less than a year old. Zarbee's or Hylands are actually been used by them. So just consult with your provider if it's okay to do so, and seek immediate care if home remedies are not working. Again, I emphasize to consult with your professional providers for further questions and concerns. This is not meant to treat, but to provide basic knowledge and implementation that will prompt you to either seek medical or immediate medical attention. Thanks again for watching.